Welcome back. We want to talk about a new global report from the McKinsey Health Institute. It says there is a gap in women's health between men and women, and that it's costing our country.
Researchers were diving into the impact of the women's health gap, and joining our conversation is our parenting expert, Dr. Cheryl Ziegler. So first, when we talk about this theme of the women's health gap, that seems kind of overarching, but what specifically are we talking about there?
Yeah, it is actually the gender gap. So meaning how women are diagnosed and treated versus how men are diagnosed and treated. So for women, the concerns are really that it's usually later. So women get sent home often, right? Just go home and rest. You're just dealing with stress. You have a lot on your plate. So they often get overlooked with the kinds of diseases that maybe a man would get diagnosed with sooner and quicker.
Some of that have something to do with there being more male doctors. You'd think everyone's taught the difference between men and women if you go through medical school, but I would think the empathy or the natural awareness of women's issues when it comes to health would be much more prevalent with a female doctor as opposed to a male doctor.
Yeah, I think that's a really good point. And one of the suggestions that came out of this McKinsey study was that in medical school that they really do need to understand disease and how it presents differently in men and women. So that's actually one of the top recommendations on what can be done to kind of lessen this gap, because it's a really important gap.
Yeah, let's talk about that more. There's some actionable items, things that can happen now that can kind of lessen this?
Yeah, I mean, I think the reason why, this study got some attention is it's interesting, two sort of different things. One of them is about women's health. And so the interesting thing is, even though women live longer than men, they say that about 25% of that time they're living longer, though, is in poorer health. So I thought that was one really interesting sort of fact that I know I wasn't really aware of. And the other piece is really, you have to look at things like the research, investing money in research to look at particular women's issues, and to have awareness campaigns like, something like this, and continue to talk about it, and to understand that the services and the needs of women are different from men, and that needs to be addressed, is something that really needs to be looked at. So all sorts of disease categories were looked at, and it's interesting because things like infertility and things, they said account for maybe 2% of what they count as lost productivity. So they were looking at health outcomes plus productivity. How much are women not contributing to the economy or their work or taking off from work because of it? And so some other things were higher that are pretty easy, they say, to study, but we just don't give it the credit. So things like headaches, autoimmune conditions, pretty linked to stress, have that mental health component to it as well.
I'm trying to put this correctly so you understand me, is that how much of this burden belongs on the patient? Because I think of the different psychologies of men and women. We talk about the man flu. The man gets a little sick and he acts like, oh my God.
Right.
Women tough it out a little bit more. Is that part of it, the equation? Is that women patients are more likely to go, I'm fine. It's okay. I got this.
Yeah, well, that for the report that I read wasn't actually addressed in this report. However, my experience says that women are more likely to kind of hold back and say, oh, I can deal with this. It takes a lot to get a woman to go in and say, I'm really, really struggling. Even the headaches that they said were reported, headaches are reported really high levels. They'll just stay home and kind of deal with it. So I think there is a piece both of doctors trusting and listening to their patients, especially when they're women, as well as women feeling empowered, like they are listened to so that they can advocate for themselves and not feel like they are just maybe complaining or making a bigger deal out of things than it actually is. So I think both are going on.
Yeah, those are important things to think about, especially going to the doctor yourself, advocating for yourself, because you expect a doctor to do it for you. But if you know these are the outcomes that are happening, you have to be your own advocate when you go into that room.
It is really important to be your own advocate, and not everybody, though, has the advantages of know what to advocate for. So I think that when we look at this in terms of systems, I think, the lesser of my concerns are the productivity and what women are adding to the economy, but more just making the years that are alive healthy years, and having a relationship in which things like endometriosis, uterine fibroids, there are really specific kinds of conditions that affect women in particular, that just they're underfunded, they're under-researched, and so women don't always get that kind of care. And those are really painful chronic conditions that women try to endure for long periods of time. So mixing that, looking at that piece with the mental health, specifically depression and anxiety, the combination is really important for women's health.
Interesting discussion. Much more to talk about. And there's also the modern day now where we just go to WebMD and figure it out ourselves.
Is this an issue?
This is
Should I go to the doctor?
this is the worst thing ever. I've got the worst thing ever. It's good to see you as always, Dr. Cheryl Ziegler. Thanks.
Thank you.